Hello and welcome. In this video, we'll be talking about typhoid fever. We'll talk about what typhoid fever is and a few things, and then we'll move into what we do in the lab to detect typhoid fever. And more importantly, we're going to compare two diagnostic methods we use in the lab. That's the Widal test and then the typhoid IgM rapid test cassette. And so let me quickly talk about typhoid fever, and then we focus the rest of the time on the test modalities that we have. We'll compare them, we'll see which is better. Okay, so typhoid fever is caused by salmonella, and where we find ourselves, you'd commonly find salmonella typhi and then the paratyphi causing the typhoid. Good. This bacteria is actually transmitted fecal-orally, and so you'll find that in regions or in countries where the sanitation is very poor, you see a large number of the citizens contracting this bacteria, and human beings are the only reservoir of this bacteria. And so you find out that you actually get this bacteria by direct contact with somebody who has been infected, even through a handshake. Yes, even through a handshake, and also indirectly through contaminated food and water. And so if you really want to avoid this bacteria, you must make sure that you keep proper personal hygiene. When this bacteria enters into your GIT, of course through the mouth because it's fecal oral, it gets into the small intestines where it affects the Peyer's patches and begin to proliferate. Eventually it enters into your systemic circulation. It can go into the liver, the gallbladder, and then the spleen, and then they begin to cause bacteremia. So usually the symptoms are headache, fever, and some abdominal symptoms. You could have diarrhea, or in very few cases you could even have constipation. Complications can lead to intestinal hemorrhage and then perforation. So that's how serious typhoid fever can get. Okay, so in the lab, what do we do to diagnose typhoid fever? The first line of test that we have is the blood culture. So we could take about 3 to 5 mils of your blood and then put it in a blood culture bottle and then culture it for 3 or more days. Good. If the bacteria is there, we'll do an antibiotic sensitivity where we would infuse some antibiotics onto the isolate and then look at which ones are sensitive and then which ones are resistant to it. And so usually you will find that the Salmonella typhi is sensitive to quinolones like ciprofloxacin, and then it's also sensitive to macrolates like azithromycin, and then third generation cephalosporins like ceftriaxone. Okay, in regions where socioeconomic situation is not so good, you realize that the blood culture is more expensive and then it takes time, and so we want a test that is rapid and quick. And you even realize that in the tropics, this is part of routine test. If you come to the hospital and you are sick, most likely you're going to run a typhoid test. Okay, so we'll be comparing the two most common that we do in the lab. So in the lab, to diagnose typhoid, we can do the Widal test. That's, we are going to use the reagent, the Widal reagent, and then we also have the typhoid IgM rapid test. So I'm going to show you how we use this one, and then we'll move to the Widal test. So this is the typhoid IgM. This is how the cassette looks like, and then it's an immunoassay. So I'm going to do for 2 samples, and then we are going to see the results. For the same samples, I'm going to do the Widal test on it so that we can compare and appreciate. So this will be patient A, and then this will be patient B. Okay, so let me you're going to put a drop of the sample, whole blood or plasma in the sample area, and then you add the buffer, and then you wait for about 10 minutes. So this is patient A. I'm going to introduce the blood. So a drop will be fine. Okay. And then this is patient B blood. I'm also going to introduce the blood sample in there. Okay, so that's also fine. And then I'm going to add my buffer. You can add 2 drops. 2 drops will be enough. 1, 2, and then 1, 2. So let me quickly explain the principle as I do always. So this test is able to detect IgG and then IgM forms of antibodies produced against the Salmonella typhi. Okay, so we introduce the IgG or the antibodies in the sample into the sample area, and then there's a nitrocellulose membrane here. On the nitrocellulose membrane, we have colloidal gold conjugated to the Salmonella typhi antigen. So the antibody from your sample will complex with the Salmonella typhi antigen in the nitrocellulose membrane, and then it will move up by capillary reaction. In a test area labeled IgM, there are antibodies coated for IgM, and then the test region IgG also has IgG antibodies there. And so if you are positive for the IgM version, the antibody and colloidal gold complex will actually mark and then be detected either at the test region 1 or 2. So basically that is the principle of the test. So while this is running and we are waiting for the results, let me focus on the Widal test. Good. So this is the Widal test. In the Widal test, we have the antigen here, which contains the Salmonella typhi gram-negative bacilli, and then they have been stained so that when the agglutination occurs, we can be able to see it. So Salmonella typhi has the body or the O antigen, and then the flagella or the H antigen. So the Widal test kit comes with these 2 reagents, the body or the O antigen and then the H antigen. And so to perform the test, you actually have to spin the samples, and then you introduce the serum onto a slide. So I'm going to quickly spin the samples, and then we introduce the serum. Okay. So to do the Widal test, we also have, I'm going to separate them into patient A and then patient B. Okay. So you have your micropipette, you set it to 20 microliters, and then you take your patient sample. So this is for patient A. You take 20 microliters and put it in well A, and then you put another one in well B. Okay, you set it aside, and then we also do same for patient B. Set it here, and then set it here. I'll explain why we use 20 microliters later as we progress. Okay, so you put a drop of the antigens on it. So 1 drop each. And then we also from here you stir. You wipe and then you stir with the opposite end in that manner, and then you discard it. And then you take another, you stir this one too, then you wipe, then you turn, and then okay. So from here you rock for 1 minute in this manner. So you do this for 1 minute and then you observe for the agglutination. So what's the principle of this test? So it's antibody antigen reaction. So you introduce the the plasma has the antibodies, and then you are introducing the antigen. So if it's a positive test, you see agglutination, and then if it's a negative test, you wouldn't see any agglutination. Okay, so let me also work this. So you do this for 1 minute. So it's after 1 minute, and then there are no agglutinations for patient A, and then there are also no agglutinations for patient B after 1 minute. But let's look at the typhoid antibodies. So this one too, there is no line showing, so it's negative. So patient B is negative for both the typhoid IgG and then the Widal test. But let's look at patient A. Patient A is actually positive for the typhoid IgM. So this is telling us that patient A has the typhoid because it's producing IgM versions of the antibody. And then from the Widal test, it's telling us that the patient is negative from here. Good. You would realize that I use only 20 microliters of the plasma. I'm going to increase the amount this time to maybe 80 microliters, and then we'll do it from there. So I'm increasing the I'm going to do the same for patient B, and then we see Then we stir, and then if you can observe, you realize that there are some agglutination for the O antigen in patient B. So I don't know if the camera can help you see it. The agglutination is forming here, if you can see it. So this is now producing a positive test for patient B, who initially had a negative test, and then on the typhoid IgG IgM also had a negative test. So what's the explanation for this? Good. So the more antibodies you introduce, the likelihood of producing a positive test. Until I introduced about 50 microliters, I didn't get a positive test. So this patient likely has a past infection, and so as you increase the titer of the antibodies, you realize that eventually it becomes positive. Okay, so that's about that. So let me quickly explain why I used 20 microliters of the sample. We realized that initially when I put the 20 microliters here, we produced a negative test, but when I increased the sample, realized that it produced a positive test. And so the more antibodies you introduce, the likelihood that the test will be positive, especially for patients in endemic regions who have had the infection before. So they have antibody that are in their blood that has been produced against the infection. And so you use 20 microliters, and any agglutination that is at 20 microliters or below is considered 20 microliters or below is considered significant. Anything, if you introduce the sample that is 40 microliters or above and have agglutination, it's more likely that it's from a past infection. So the antibodies are already in the blood. That is why you use 20 microliters, and that titer corresponds to 1/80. And so always make sure to use 20 microliters or below. So any agglutinations from 20 microliters or below is actually showing significant current infection. So you should really take notice of that. Good. So if you compare the two tests, you would say that the typhoid IgM is more sensitive than the Widal test. Thank you.